Hello everyone, welcome back and thanks for tuning in. This is the third video series about facial thread lifting using absorbable threads. In this video, I will specifically explore the origins of thread lifting and interview the inventor of APTOS Threads and methods, Dr. George Sulamanidze. Finally, I will also highlight the most suitable candidates for this type of procedure. First, let's take a journey into the history of threads. Did you know that the first threads discovered for face lifting can be traced back to ancient Egypt? In modern times, 24-karat gold threads, also known as golden threads, have been developed and utilized for cosmetic purposes in Asia. If you're a dentist or a dental student, you may come across some older radiographs that resemble this. The threads fell out of favor quickly due to their lack of lifting effects. Barb threads have been employed in orthopedic surgery, particularly for Achilles tendon repairs, since 1968 by specialists from Germany and the United States. However, the first barb threads specifically designed for cosmetic use were introduced by Georgian plastic surgeons Marlon and George Sulamanidze in 1998. They branded this innovation initially as APTOS Threads and now as APTOS Threads. The term is derived from the Greek words anti, meaning against, and ptosis, meaning sagging. This marked the beginning of soft tissue thread lifting, which they have showcased globally since 1996. In Singapore, Dr. Waffles Wu developed a barbed suture sling in 2002 known as the Waffles Lift. Furthermore, experts from Philippines, Bulgaria, and France have contributed additional research on thread lifting techniques. The 20th century saw significant technological advancements that revolutionized thread lifting procedures through the development of synthetic thread materials. Absorbable threads made from polydioxanone, or PDO, polyl-lactic acid, or PLLA, and polycaprolactone, or PCL, have become standard in the field. To delve deeper into these topics, including various thread designs, post-procedural effects, and potential complications, be sure to check out this video in the link here. Fast forward to 2025, thread lifting using absorbable threads is recognized as a minimally invasive, in-office procedure performed under local anesthesia. And it continues to be an essential tool in aesthetic medicine. Now to the interview with Dr. George Sulamanidze, the inventor of the family-owned APTOS Threads, while I visited their manufacturing facility in Tbilisi, Georgia, and also with their expert trainer, plastic surgeon, and scientific officer, Dr. Murat Tsintsadze, on the combination treatment with a new injectable product. Hi everybody, my name is Dr. Laurena and I'm very happy here to interview Dr. George, who is a plastic surgeon and also one of the creators and founders of APTOS Thread Lifting. So welcome and
thank you.
Thank you so much. Can you please tell me a bit about yourself and your background?
My name is George Sulamanidze. I'm a plastic surgeon. I'm also a general director of the company, APTOS. I'm managing our family business. I'm one of inventor of APTOS Threads, together with my brother, Konstantin, plastic surgeon, and together with my father, Marlon Sulamanidze.
Yes, you are actually, your father actually is like the father of thread lifting.
Yes.
And it's been basically the last 20 years or more that you have actually developed and innovated thread lifting. So can you describe what has been important aspects of this?
As you mentioned, yes, my father is the founder of thread lifting procedures in aesthetic world, because before my father there was no thread lifting.
Yeah.
And he created first thread, he patented first thread, and he also started to produce first thread under our brand, APTOS Threads. So we have a huge experience of using threads in our practice. We know, let's say, everything about the threads. And of course, in our hands was built and developed a lot of different methods, techniques, and also solutions for our patient, what is very important, because threads is not only the material, it's not just a simple thread. The thing is, the thread is just an instrument in the hand of the doctor. And with a proper way of using this instrument, we can achieve very nice result, treating many problems for our patient, whether it is face or body.
Yes, this is the next question I want to ask you, because you have over 30 different types of threads, and you have also 50 different types of indications, both medical and cosmetic. Is that correct?
Yes, sure.
Okay.
And if we are speaking about thread lifting procedure, we can use them as anti-aging solution when we rejuvenate face or body. We can use it as a beautification, for example, for young patients, like when we are doing like foxy eyes or nice cheeks or sharp jaws. And of course, we can treat such problems like, for example, facial palsy, some problems in gynecology, some problems on the facial asymmetries, and many other things, of course.
Wow, wonderful. So thank you. Wow, amazing. And also, one question though I have sometimes is patients are sometimes a little bit afraid of thread lifting because they have a conception that it might be quite painful. Maybe they can see the thread afterwards and the result is not very symmetrical. What do you have to sort of say about that?
All this coming from the past, because on very beginning, when we just started with the threads, and also the other companies started to use thread material for such procedures, of course quality was not so good. Was not so good, not because that company was not care about quality, no, but it was like a first steps.
Right.
And also doctors was not familiar with using that product in the practice. That's why there was different type complications, different type side effects when patients was not satisfied with the result and having some troubles later on. Today, of course, after 30 years of experience in case of APTOS in ourselves and also other companies as well, we grow this experience to create a quality product which is absorbed with the time. Of course, it doesn't leaves any signs in the tissues if you use it once or even many times. It gives very nice results for the patient, satisfied results, and it is very safe today because doctors also very well know how to use them, because we, for example, in APTOS, we spent a lot of effort, time, investment in training doctors, and this is also very important.
Yeah, so that's what I really admire about your company is firstly, not only do you train your doctors, but you also support them afterwards with the training. And one of the amazing things I found today with the talk was, talking about complications, was even if your trained doctors have complications from other companies, you also support them and help them, which is extremely generous. So, like that's amazing and very great. So, I appreciate that a lot. There's a special type of thread that you also make. You're one of the first who actually combined thread with hyaluronic acid. So can you tell us what's the difference between just thread and just the combination?
From the beginning, when my father invented first threads, the idea was to fight only against one problem of aging, which is the ptosis, sagging of the tissues. That's why we call our threads APTOS, anti-ptosis solution, so anti-sagging solution. But with the time we understood that using absorbable materials, and in case of APTOS it is polylactic acid with caprolactone. Polylactic acid is quite good stimulator, as you know, we are using it in aesthetic as injectable solution. But polylactic acid gives us a little bit long lasting and let's say we deliver such a stimulation a little bit later.
Okay.
So we were thinking what we can use in addition to get a booster effect immediately, and hyaluronic acid is the best stimulator we have today on the market. So we combined these solutions together with these two stimulators together. We have our own technology, we call it NAMICA technology, which is really unique technology, and this technology gives us possibility to achieve additional results for our patient. This is a biostimulation effect for the skin and soft tissue layer, which is very important whether it is young patients or aging patients, we can rejuvenate skin quality again. This is what our threads additionally do today with mechanical effect of lifting.
Because like you said, a lot of patients want minimal downtime. They also want a lot of benefits from one treatment session. I think there's more and more demand and patients are more demanding. And it sounds like that the process of thread lifting is maturing and the techniques are getting better. So I have a last question to ask you. Where do you think the next innovation possibly could be in thread lifting? What gaps can it fill?
You know, what we are thinking about right now is that we understood that with the threads we can achieve really good biostimulation effect. And the biostimulation is one of the main process of aging when we need to correct quality of skin and tissue. That's why we are thinking now about solid biostimulators, which will work only for biostimulation, which will include inside a big quantity of hyaluronic acid, polylactic acid, some other biostimulators as well, like for example collagen or hydroxyapatite. In our development we already have some kind of threads. It will be like a simple small threads, for example, which will be used as injectable version, very simple version, without downtime, like any injections, but giving quite long-lasting biostimulation for more than 1 year, comparing with others, which gives just for a few months. And immediate, also very good booster effect. Because solid biostimulators gives us additional advantages. It is not liquid, they will not migrate, they will not create some kind other problems that can happen with some liquid systems. And we are thinking about that direction to increase biostimulation process in our threads.
So not only do you have better quality products, but they are safer as well for the patient and the end user. Well, thank you. That's really amazing. One last thing, do you have anything that you think people should know about that I haven't asked you?
You know, what we need to understand is that aesthetic world today grows so fast. So sometimes we are getting new ideas, new products, and unfortunately some of them, they don't have a background.
I see.
And what is most important, we need, if we are doctors and if we are patients as well, by the way, we always need to check with the doctors if the product and method has a scientific background. This is very important.
Yes, the evidence.
Yes, the evidence. So if product has evidence, it is already has some clinical research, some histological research, it is certified. In that case, of course, we can believe it and we understand that it is first safe and second effective.
Yes, thank you. That's wonderful. Thank you for explaining it so clearly.
Thank you very much.
Hello everybody, my name is Dr. Laurena Law and I'm very happy here today to be able to interview Dr. Murat.
Thank you.
So thank you for coming on. And firstly, I wanted to ask you to introduce yourself and tell me a little bit about your background and expertise.
Thank you very much. First of all, welcome to Georgia.
Thank you.
I'm very happy that you are here. My name is Dr. Murat Tsintsadze. I'm the plastic and the reconstructive surgeon and the APTOS scientific supervisor. Also the expert trainer for the thread lifting methods and also for Allure liquid biostimulator. So I'm working with APTOS almost 10 years already. Yes, 9.5, something like this, 10 years already.
Wonderful.
So I would say that I cannot be humble to say that I have a very big experience working with the APTOS threads and in this field. And to tell the truth, I can easily recommend those products to patients and to doctors as well.
And also because you're a trainer, you trained also many doctors, and this is one of the philosophies that I really like about APTOS, is that they provide the training to make sure that we're using great products with great technique. So I really appreciate that. And I wanted to ask you a bit more about the biostimulators. One of the products that's come out is called Allure. And can you tell me a little bit about what biostimulators actually do?
So first of all, I'm also very happy to announce that the APTOS has invented the new formula type of the liquid biostimulators, because before the APTOS was working only with the solid biostimulators like threads, but now like 2 years ago the APTOS launched also the PLLA plus HA and plus CMC type of the liquid biostimulator. And why this product can be superior, for example, than the other one? Because first of all, we know that with the type of the PLLA products, we always have a risk of granulomas.
Yes.
We know that.
Mm-hmm.
With Allure, this type of the complications are set to the very low level. We don't have the potential, let's say, the high risk of those granulomas working with Allure. Another thing is that this is the combination. This is not only the poly-L-lactic acid, but also combination with the hyaluronic acid. So it will give us not only the boost of the collagen, but also the boost of the elastin as well. And why it's beneficial, why it's good for our patients, because just simply for our patients to understand, so that makes skin much more firmer, much more elastic. It helps with the problems of the superficial wrinkles as well. It's a prevention of the aging process. And what's important, I think, especially for the patients who are afraid of the overcorrection, that the PLLA type of liquid biostimulators, they give us a very natural results. I mean, very light volume, a small contouring of the areas, and of course, using the natural, our own resources of the organism, like the collagen and elastin stimulation. Yes.
So there are different types of collagen, type 1, type 2, type 3. Can you sort of explain a little bit more about what the benefits and what they do?
Yes, just simply to explain to our patients that for looking young, let's say like this, and to prevent the aging process, the most important, we know that it's important to have the collagen type 1. For that reason, we don't need collagen type 2.
Yes.
And we need also a small portion of the collagen type 3 as well. But the most important is still type 1.
Right, okay.
With Allure, we increase those two types of the collagen, 1 and 3.
Yes.
And even after several times, the collagen type 3, which was boosted by Allure, degrades. I mean, let's say it slowly goes in the type 1. So it means that the collagen type 1 increases in the level. And this is exactly what we need for the, let's say, the beautification reasons. And plus also the HA in the formula, if we are using Allure with HA, boosts the elastin on the skin that makes the softening of the superficial wrinkles, making the skin more elastic, let's say like this, and so on. So this is for our patients is more from the very beginning. It's very important they to understand that the PLLA type of the biostimulators, they cannot be compared to the facelift, or they cannot compare to the thread lift, because the thread has the reposition possibilities, but the Allure and PLLA, they're gradually treating the tissues to avoid later aging process and to have a light changes in the contour and the small volume maybe, and so on.
I see. Okay. So what are some of the areas that commonly Allure can be injected into?
That's a good question, because it's used also for the gluteal area as well, for the buttocks, to reshape it, to give a volume, to, let's say, improve reduce the imperfections and so on, so for stretch marks as well. But for the face, it's used mostly in the middle third of the face, and also for the submental area, and also for the neck as well. And also near the ears as well, wherever we have the wrinkles, superficial potential wrinkles as well, so they can be used there. Mostly they are not used on the nose, on the forehead, and they are not used on the palms as well. So in other cases, wherever we want, we can use them. It's easier to use them on the body, because on the body we don't have the risk areas, let's say like that. But on the face, we have some small risk areas, and the professional doctors and the doctors trained with Allure, they know how to avoid it. And plus, this is the product with minimal risks, as I told you.
Yeah, so we mentioned the complications. So from the product side, the product quality is very good and it's very innovative. From the doctor's side, what are some of the things that doctors can do to minimize the granulomas and nodules?
Yeah. So first of all, I will tell you that the working with Allure, you already minimize the risks. So let's say to minimize the risks of the granulomas and complications with the PLLA, you have already with Allure, you will have a very small possibility of that. But the thing is that, so you know, sometimes happens something. So in case you used a bit more of the product, or let's say you injected a bit superficially.
Right.
This product is very versatile, so you can easily say correct the situation. But in general, talking about how to minimize the risks of the complications, I think this is that first of all, always to work on label and always work by the protocols and the guidelines the company and the trainer gives to you. Okay, never do the off labels and never do some inventions by your side. And another thing is, of course, that using the sterile cannulas, the gloves, and so on.
Yeah, thank you so much. That's very helpful.
Very much. Thank you.
I also want to ask a little bit more about what you do in terms of the combination treatments, because nowadays there are many different types of products, and one of the other things is using thread lifting as well. So what is the common procedure that you would approach thread lifting and biostimulators?
So in which cases you mean? So I think that our patients, majority of our patients are for combinative treatments, because I don't know how in your country, but in Georgia and East Europe, usually the patients are coming in 35 plus and so on. That means that you will not be able to work only with one type of the product. You need to work also with the combinations as well. And these combinations can be threads and fillers. It can be threads and the biostimulators as well. But it's very important to understand about the protocols when you are doing it. In one session, in different session, or maybe sometimes the patient needs to come several times to the doctor, because when you use the biostimulator and you're using a lure, working with the threads in the same session, in the same area, it's not a good idea. So you either need to split the areas and use a lure, for example, on the lower face and the threads for the upper face. Or first of all, you do a lure, and in the same area, after 2 months, you do the threads. And it's even better because the allure prepares the basis for the threads, and the later threads can easily be fixed inside the tissue. Also, the toxins. So we can make the combination of the toxins with the threads, but the toxins and the threads are never done in the same area. Never. 2 weeks always needs to be before, because with APTOS type of the threads, we are using an anesthetic solution. And when you inject the toxin and plus then you will use the anesthetic solution for the threads, you can spread the toxin over the So that's why it's always better to do first of all toxin to receive all benefits from the toxin after 2 weeks, and the relaxing of the muscles, receiving the results and the effect, and only after that you will more understand what type of treatment you are going to do with the threads.
So I really like that approach of staging the treatments with different products. And I think it's important for people to understand that there's a reason for it.
But it's very important to understand for the elderly patients, because they usually think that when they come for the mini-invasive treatments, it can be done in 5 minutes, everything all together. And the patient coming 96 years old, telling you that I want to in 5 minutes do the whole face, you need to tell them that, I mean, when the process is already 96 years old already, and you're getting old, 96 years old, it's impossible to do everything in 5 minutes, even 30 minutes. You need for these several sessions and different type of the treatments in case you don't want to go for surgery. Otherwise, we have a surgery and
if that's not reversible.
Exactly.
So in terms of, say, the biostimulators, usually how many sessions do you need to do to get the optimal results?
So younger patients, 1 session usually is enough. If it's like from 25 till maybe 30. But if it's 30 plus and 35 plus, in such a cases, I think 2 sessions, maybe 3 sessions as well. Usually do not depend on the age. It depends on the tissue and the skin quality. It depends. In some cases, it can be 1, as I told you, but in case the tissues are not that good and the subcutaneous tissues is like a butter inside, when you touch it and you slide it inside with the cannula, then I think 2 sessions is minimum.
Minimum.
But every 2 months we can do 3 or we can do 4 as well. So
I see. Okay.
So what's really important to understand that also the patient will ask us most probably how safe the material is if we are going to use 2 times and 3 times, you know.
Yeah.
So this is, we know that the polylactic acid is the material which is also in our organism as well, the PLA and HA. So this is the very well-known material for our organism, for our body. So it's not that we will receive any type of the rejection and so on and so on. So it's even better to use it in 2 months sessions.
Yes, and for long term also.
Yeah, exactly.
Okay. Wonderful. So is there any future changes or innovations that you think will be more commonplace in minimally invasive procedures? What do you?
Well, you know, to tell the truth, I didn't think about this before, but I think that everything nowadays moves to the mini invasive treatments.
Yeah.
I think that the surgery, I don't know, there are questions that will we need plastic surgery in future. So because you never know with the artificial intelligence and so on and so on. So most probably there will be, you know, in nearest future that everything will be done easy way and really in 5 minutes.
Right. Yes. So so that sounds fantastic and really amazing.
Yeah. And safely, of course.
And safe as well. So more accessible.
Yeah.
So I think this is the future of natural beauty. And I think we're in very good position with world experts who are providing training and education around these products. So thank you again so much, Dr. Murat.
Thank you very much.
Not everyone is a suitable candidate for this treatment. Ideal candidates for thread lifting include: number 1, patients with mild to moderate sagging, or grade 1 and 2 ptosis. Number 2, have sufficient skin thickness to prevent threads from becoming palpable. Number 3, do not have excessive facial fat. These patients may need liposuction or to lose weight first. Number 4, have loss of volume, eyebrow droop, or have fine lines and wrinkles. Number 5, have lost skin elasticity and tone. Number 6, have mild mid-face sagging. Number 7, experiencing relapse from previous facelifting or neck lifting procedures. Number 8, are in good general health and mental health. Individuals not suited for facelifting are those with: number 1, thin skin. Number 2, excessive skin laxity. Number 3, are excessively obese or have heavy, rugged skin. Number 4, have had permanent implants or fillers in the treatment area. In summary, facial thread lifting is a minimally invasive office procedure poised to remain a staple in aesthetic medicine. However, achieving positive outcomes rely on key factors: effective procedural techniques, high-quality threads, appropriate product selection, and the careful selection of suitable patients. Thanks for watching. If you enjoyed this video, please give it a thumbs up and leave a comment below with your thoughts or questions. Don't forget to subscribe and hit the notification bell for new video updates. See you next time.